In this video, I walk you through some of the important structures that we see in the cranial base. Recall, cranial base is exactly where brain sits on. I start with the anterior bone, which is frontal bone. Deep inside the frontal bone, where I'm pointing at, we must find some air-filled cavities, which we name them frontal sinuses. This is not a real skull, so we do not actually see the frontal sinuses. We just locate where they're supposed to be. Recall, frontal sinuses are lined by ciliated, pseudostratified columnar epithelium. The epithelial tissue contains goblet cells that secrete mucus, and then mucus from frontal sinuses should be emptied into the nasal cavities. So from the frontal sinuses, we find frontal ducts that open these cavities into the nasal cavities exactly below middle nasal conchae in the spaces that we refer to them as middle nasal meatuses. Then in the middle, I can see a very small part of the ethmoid bone, which is called cribriform plate. This is a very thin partition that separates nasal cavities from cranial cavity. We can say that cribriform plate forms the roof of the nasal cavities. And in the cribriform plate, we find about 20 openings that we refer to them as olfactory foramina. Clearly, these are passage for olfactory fibers, cranial nerves number 1, to exit the nasal cavities and enter the cranial fossa. In general, cribriform plate is thin and mechanically weak, so a blow to the frontal region can easily fracture the cribriform plate. And please keep in mind, if cribriform plate due to trauma is fractured, it also causes usually laceration of dura mater. Recall, dura mater is the outer of the 3 meninges that surround the brain. And the reason that laceration of dura mater happens is simply because that elevation here, which is called crista galli, is the attachment point for falx cerebri. That would be part of the dura mater that we separate cerebrum into 2 cerebral hemispheres. And when cribriform plate is fractured, that simply means that cerebrospinal fluid can leak into the nose. So in the patients that we have a blow to especially the frontal region, and we see that the patient has a runny nose, that could be an indication that cerebrospinal fluid is leaking from the cranial cavity into the nasal cavities. That's something that we have to take it very seriously, because as we know, in cerebrospinal fluid, we are not supposed to find any microorganisms. But the moment nasal cavities are open and connected to the cranial cavity so easily due to the fracture of this cribriform plate, bacteria from nostrils enter the cerebrospinal fluid and cause infectious diseases such as meningitis. So after learning about the cribriform plate of ethmoid, olfactory foramina in cribriform plate, and the crista galli, that elevation, I move to the butterfly-shaped bone, which is sphenoid bone. This is one of the most complex bones that we find in the skull. This is the bone that articulates with all other cranial bones, and we divide it into different sections. We name this part of sphenoid bone body of the sphenoid. We name these 2 small triangular shaped parts lesser wings of sphenoid bone, and we name these very large areas greater wings of sphenoid bone. So body, lesser wings, greater wings. In the body of the sphenoid bone, we find a saddle-shaped structure which forms by 2 elevations and a depression between these 2 projections. We named the posterior projection dorsum sella. We named the depression that I'm pointing at right now hypophyseal fossa. And we named the anterior projection tuberculum sella. And we refer to tuberculum sella, hypophyseal fossa, and dorsum sella, all 3 together, as sella turcica. This is the place that we find pituitary gland. So pituitary gland literally sits inside the hypophyseal fossa, and we can say that somehow is protected by tuberculum sella and dorsum sella. Between body of the sphenoid and lesser wings, we find these two openings. We refer to them as either optic canals or optic foramina. These are passage for optic nerves. Cranial nerves, number 2. Recall, optic nerves transmit visual signals from the eyeballs to the brain. So now it makes sense whenever we have, for example, tumor of the pituitary gland, why the patient experiences some visual problems. Simply because the optic nerves pass very close by to the pituitary gland. So enlargement of the pituitary gland can easily press and put pressure on the optic nerves. Then I focus on what I see between lesser wing and greater wing. We can see some long triangular shaped openings on both sides. We name the opening between lesser and greater wings superior orbital fissure. Many important structures pass through superior orbital fissures. For example, several of our cranial nerves pass through superior orbital fissure, such as oculomotor nerves, abducens nerves, trochlear nerves, and even ophthalmic nerves, which are branches of trigeminal nerves. So the two superior orbital fissures, which clearly we can see them also when we look inside the orbits in the anterior view, are important pathways for many anatomical structures that we have. From superior orbital fissure, I start moving posteriorly, walking through the greater wing. Right behind, posterior to superior orbital fissure, I can find these two foramina that we refer to them as rotundum. For example, maxillary branch of the trigeminal passes through foramen rotundum. And then from foramen rotundum, I move again, walk through the greater wing posteriorly, and I see the oval shaped opening that is called foramen ovale. For example, mandibular branch of the trigeminal passes through foramen ovale. And then when I move more posteriorly, near the end, the edge of the greater wing, I find foramen spinosum. So if I walk through the greater wing, we have rotundum, ovale, spinosum, ROS. So remember ROS. All three are located on the greater wing of the sphenoid bone. And then I notice this opening that is located between sphenoid bone, temporal bone, and occipital bone. That would be called foramen lacerum. So if I look at the other foramen lacerum, I see that lacerum sits medial to ovale and spinosum. And if you connect ovale to lacerum, lacerum to spinosum, spinosum to ovale, you see a triangle. And hopefully this helps. Lacerum, ovale, spinosum, LOS, loss. Please keep in mind, lacerum is open only in a dried skull. In a living human, lacerum is covered by a layer of fibrocartilage. Only we see it open if it's a dried skull and we have lost the fibrocartilage layer. After sphenoid bone, I go through the two temporal bones. So that would be the right temporal bone. This is the left temporal bone. We have a projection in the internal view of the temporal bone. That is called petrous portion of the temporal bone. For example, inner ear, middle ear, they are deeply located inside the petrous portion of the temporal bone. And then when I look at the medial wall of the petrous portion, we find internal acoustic meatus. Many important structures pass through internal acoustic meatus. For example, facial nerves, vestibulocochlear nerves pass through internal acoustic meatus. When we say a structure, a neurovascular structure passes through one of these openings, it doesn't mean that definitely that structure gets out of the opening in the other side of the skull. In a separate video, I walk you through the inferior view of the skull, but in general, please know some of these neurovascular structures enter an opening here, but they exit a different opening when we get to the inferior view. For example, when facial nerves enter the internal acoustic meatus, when we learn about the inferior view of the skull, we see that most of their branches of facial nerves exit through the stylomastoid foramen. So that's something to note, that the detail of the anatomy is more complex than what we explained in this video. And then from internal acoustic meatus, when I move posteriorly, I see this very large opening which actually sits between the petrous portion of the temporal bone and the occipital bone. So this opening is located between temporal and occipital, and we name this opening jugular foramen. Clearly we know that the jugular vein passes through this, and also some of our cranial nerves. For example, cranial nerves number 9, glossopharyngeal, vagus, number 10, accessory, they all pass through the jugular foramina. And recall that the flat section of the temporal bone would be referred to as temporal squama. So I'm pointing at the internal view of the temporal squama. After temporal bone, then I walk through the occipital bone. First, I locate foramen magnum. Recall that exactly in foramen magnum, part of the brain named medulla oblongata fuses to spinal cord. So that explains why this area has to be protected. For example, when we want to transfer a patient to the hospital, first thing that we do, we stabilize the neck. We do not want any inflammation or any pressure on that section that is located in foramen magnum, because in medulla oblongata of the brain that is sitting very close to foramen magnum, we have some important visceral control centers, including the neurons that control breathing. Lateral to foramen magnum, we can locate hypoglossal canals. So I can see the two hypoglossal canals, lateral to foramen magnum and superior to foramen magnum. Obviously, we know that hypoglossal nerves pass through the hypoglossal foramina, and when they exit, then we know that hypoglossal nerves mostly supply the muscles of tongue. So the movement of tongue depends on the nerves that pass through the hypoglossal canals. And then inside the occipital bone, I can see this large elevation that is called internal occipital protuberance. And please note that inside the cranial base, we can see a small section of parietal bones. So those are the parietal bones that I'm pointing at. But in general, these are the details that we can see in this skull, which I emphasize, this is not a real skull. So some of the anatomical structures that we can see in a real skull are missing here. But at least in this video, we were able to go through some important structures and also name some of the neurovascular structures that pass through them or are attached to them. I hope you find this helpful.